Need to adjust it, William.
Okay. My name is William Osborne, live in Eden. I'm here representing no political party or organization tonight. Medicaid Expansion is a program designed to help the working poor who earn too little to buy private health insurance of their own, but earn too much to afford to take advantage of currently existing Medicaid. The rejection of Medicaid Expansion was politically motivated, was economically irrational and irresponsible, and the policy of rejection reflects a policy that is morally bankrupt. The refusal of the governor and the state legislature to accept Medicaid Expansion has significant implications for Rockingham County as well as the rest of the states. North Carolina hospitals will lose an estimated $666 million each year that the legislature refuses to accept federal funds. Cost of health insurance for individuals, small businesses, and corporations has increased in order to offset the cost of free services doctors and hospitals must by law provide. North Carolina has lost the opportunity to add 18,000 to 25,000 new healthcare jobs in the state, while we have one of the worst unemployment rates in the nation. Medicaid money that flows into a community stimulates economic activity for small businesses. The governor and the North Carolina legislature double-crossed our hospitals and our medical communities when they were asked years ago to take reductions in Medicare funding, believing that they would be given back the opportunity to make some of these funds back by Medicaid Expansion. The Medicaid Expansion never came. The politicians have placed a financial burden on all hospitals and put at great risk the smaller independent and affiliated hospitals such as Annie Penn and Moorhead. Through our federal dollars, the people of North Carolina are paying for Medicaid Expansion. Let me repeat that. The people of North Carolina are paying for Medicaid Expansion, only we're not getting it. Our tax dollars are being spent to help other states as other states can better help their citizens while we neglect our own. The tax dollars should be spent right here in Rockingham County supporting our medical and psychiatric community, our hospitals, as well as our local businesses. The healthcare statistics for Rockingham County are dismal. The 500,000 working people who are the working poor in North Carolina, and I underline that word working, for this state are not second-class citizens, nor are they children of a lesser God. It is total hypocrisy that 80% of the North Carolina Senate and House members are willing, through their part-time employment as legislators, to have the state pay for their health insurance while denying 500,000 citizens the use of Medicaid Expansion paid for out of federal dollars. I therefore ask that by passing a resolution, you send a clear message to the governor and the legislature that this board is willing to stand up for our doctors, our hospitals, our medical and psychological service providers, and our local businesses. Most of all, I ask that you are willing to stand up and have your voice heard for the working poor of our county and state. Join the 20,000 people in the governor's hometown of Charlotte who have signed petitions demanding a change. It's past time for the governor to call a special session of the legislature and correct this legislative injustice. Thank you.
Okay. Thank you, William.
Was that last beat my overtime?
Yeah, well, it was, but you was okay.
Sorry.
I'll give you a couple of my seconds.
Thank you, sir.
Okay. Thank you again, William. This time.